Hello, everybody. My name is Casey Richardson, and my dad partner was Jennifer, and we worked on binge eating disorder together. I was responsible for the overview of binge eating disorder. The DSM-V criterion for binge eating disorder is as follows. Criterion A, recurrent episodes of binge eating is characterized by both of the following: eating a significantly larger amount of food than most people would eat in a similar circumstance in a discrete time period of 2 hours or less, feeling a sense of lack of control over eating during an episode. Criterion B is binge eating episodes are associated from three or more of the following: feeling disgusted with oneself, guilt, and depressed after an episode, eating large amounts of food when they are not physically hungry, eating more rapidly than normal, eating to the point of feeling uncomfortably full, eating alone because they feel embarrassed about the amount that they are eating. Criterion C is marked distress regarding binge eating is present. Criterion D, binge eating occurs for an average of at least one time weekly for a duration of at least 3 months. And criterion E, the binge eating episode is not associated with recurrent use of behavior of bulimia nervosa, and it is not occurring exclusively during the course of anorexia nervosa or bulimia nervosa. Suffering from binge eating disorder is for 12 or more months is present in 1.6% of females and 0.8% of males in the United States. It is more prevalent in individuals who are seeking weight loss treatment than the general population. Binge eating disorder appears to run in families, which potentially reflects an additive genetic influence. The comorbidity, binge eating disorder is associated with psychiatric comorbidity of bulimia nervosa, anorexia nervosa, and its most common comorbidity is bipolar disorder, depressive disorders, and anxiety disorders. Some of the differential diagnoses for binge eating disorder are as follows. Bulimia nervosa is one. Binge eating disorder has commonalities with bulimia nervosa. Purging is not present in binge eating disorder, and individuals with binge eating disorder typically do not present with sustained dietary restrictions and impact body weight between binge eating episodes. Binge eating has more successful recoveries than those with bulimia nervosa. Obesity is another one. The levels of overevaluation of body weight are higher in those individuals who are suffering from obesity. Rates of psychiatric comorbidity are higher among obese individuals. Long-term success rates of evidence-based psychological treatments for binge eating disorder can be contrasted with the absence of effective long-term treatments of obesity. Bipolar disorder and depressive disorders are also differential diagnoses. Increased appetite and weight gain are also on the criterion for major depressive episodes and in the atypical feature of bipolar disorder. Binge eating is seen with other symptoms of bipolar. And borderline personality disorder is also a differential diagnosis, and binge eating is included impulse behavior in the criterion for borderline personality disorder. And a little bit later on in our PowerPoint, you will see a link to a video that I have posted, a YouTube video from a man who suffers from binge eating disorder. It was published by WebMD, and it gives you a firsthand story and experience of someone who is suffering from this disorder.